Hello, welcome everyone. I am Adil Sadiq Additional from Nigeria. I am Adil Sadiq Additional from Nigeria. Good to see everyone here for 2020 Africa Festival. We are here to discuss, to present to you the topic of our presentation today, a new normal norms era for. So I'm here to present my co in person of Dr. K. Oloyede Ganiyat. Was born in Ibadan, State, Nigeria on March 1971. She attended University of Ibadan, Nigeria 1988 to 1992 for a bachelor degree in chemistry, pure and applied science, which she bagged second class honor. Upper division, she obtained a master degree in synthetic medical chemistry in 1997 and a PhD in medical natural product chemistry in 1998 to 2005 in the same institution. In Faculty of Pharmacy, where she came out with distinction. She proceeded to National Open University of Nigeria 2014 to 2015 to obtain a postgraduate diploma in education. She recently obtained a certificate in conflict analysis courses, education, and training online. From United States Institute of Peace 2015, certificate of completion for United Nation Global Amino System of Classification and Labeling of Chemical 2016. United States Department of Transportation USDOT General Awareness of Hazardous Material 2016. Laboratory Safety and Chemical Hygiene 2016. Certificates in Home Health, Diet and Nutrition 2016 and certificates in Research Reading in Science 2019. She is a recipient of many awards: Basoremku Abiola Postgraduate Fellowship 2000, Third World Organization for Women in Science Fellowship 2003, Mark for Recent Startup Research Grant 2010, Senate Research Grant 2010, ICCB, the World Academic of Science TWAS Fellowship 2015. Total Education Trust Fund, Institute Based Research Grant 2016. University of Ibadan Conference Support Fund 2018. Representative of a 2019 and 2020 Chemistry Festival Grant of American Society, American Society International Year of Periodic Table, IYPT Activity Grant 2019, and American Society International Student Activity Grant 2019. She is a member of many professional bodies, member Institute of Chartered Chemists of Nigeria, member Chemical Society of Nigeria, member Scientific Officer Association of Nigeria, member Organization for Women in Science for Development World, member of American Society USA, and member Congress of Essential Oil Distiller of Nigeria, CEODAN. Our research interests include natural product chemistry research and study medical chemistry. She has over 70 published academic journals to her credit. She is still actively engaged in many collaborative research activities. She has attended many workshops and conferences and delivered papers in different fields, ranging from education, food, pharmaceutical, and natural products chemistry research both locally and internationally. She has served as a resource person in a number of workshops. Her work experience has spanned over the year. She worked briefly as a chemistry teacher during the chemistry compulsion Chemical National Youth Service course at Government College Ekori in Cross River. So I'm here to share the screen to everyone to see what I'm presenting over here.
Thank you, Mr. Sadiq, for that beautiful citation. So let me just go ahead to my presentation. Hello, everyone. This is the 2020 Virtual Africa Science Buskers Festival. I'm Dr. Ganiyat Oloyede from the Department of Chemistry, University of Ibadan, Nigeria. Now, the issue of COVID-19 is not something to joke with. Coronavirus has caused many fatalities, and it's been bringing more attention, especially now that many schools are contemplating reopening. We don't want our students to get infected, so this is why this presentation or discussion is timely. We just have to keep enlightening ourselves so that we abide by the regulations and protocols as set down by Center for Disease Control in all countries. So that's why I've chosen this topic to present to you: a new normal for students in the era of COVID-19 pandemic. What are we supposed to know? We want to know more facts about COVID-19, symptoms of someone infected with COVID-19, what are the preventive measures or prophylaxis to abide to? Then what do you do in case of emergency? By the end of this presentation, you agree with me that we have to abide by this new normal. A new normal has definitely come, which we must all abide with. What are some of those facts about COVID-19? COVID-19 is a dreaded coronavirus disease, and it was first discovered in Wuhan city of China, first reported to WHO Health Organization on 31st December 2019. Coronaviruses are large family of viruses that are known to cause illness, ranging from common cold to more severe diseases such as Middle East Respiratory Syndrome and severe acute respiratory syndrome. You agree with me so far that it is a deadly disease and it doesn't have a cure as of this present moment. It has claimed thousands of lives and is still spreading across the globe. Drastic measures are being taken to make sure that scientists discover vaccines for prevention or drugs that can cure it. Scientists are working day in and out to make sure that a drug is invented or discovered to be able to cure the disease. Also, you notice that coronavirus pandemic has kept all nations at lockdown. You've not been able to go outside our homes for many months. It has affected all facets of life, be it health, economic, education, transportation. Our students have been in their houses for the past 6 months. It's only the exit classes that are supposed to write the West African School Senior School Certificate exam that have been asked to resume school. And with this aside, certain preventions must be abided to. And also by the time the other students join them, so we have to maintain some rules or abide by some rules to make sure that we flatten the curve of transmission. Therefore, a new way of life is essential at this present dispensation to curb the spread of the coronavirus. What are some of the symptoms of someone infected with coronavirus? Common signs include respiratory symptoms, fever, cough, persistent pain or pressure in the chest, shortness of breath, or breathing difficulties. In more severe cases, infection can cause pneumonia, severe acute respiratory syndrome, kidney failure, or even death. Now, I want to put this question to all of us. Is there a vaccine or treatment for a novel coronavirus? No. When a disease is new, just like we have in the case of the coronavirus disease, there is no vaccine until one is developed. It can take a number of years for a new vaccine to be developed. Also, there is no specific treatment for it as of today. However, many of the symptoms can be treated. Treatment is therefore based on patient's clinical condition. Supportive care for infected patients can highly be effective. This means that depending on the symptoms that is presented in each patient, that's what the doctors treat. Whatever symptoms are observed, it has to be treated in line with that, and symptoms varying from one patient to the other. Now, because we don't have any drug or vaccine to treat it, we must take certain preventive measures. We don't want it to get transmitted any longer, especially now that our students are resuming. Our students are the future of tomorrow. We don't want anything to happen to them. And if they get infected, there is no way they will not infect their family members, neighbors, and people that come across to them. So many schools are contemplating opening schools for normal academic purpose, despite the ravaging coronavirus. You have to remember that coronavirus can be transmitted from person to person, usually after close contact with an infected patient, for example, in a household, workplace, in schools, amusement parks, or healthcare center. What are some of the measures to be taken? Presently, prevention by modification of social lifestyle habits in order to break the chain of transmission is the main thing. First thing to note is that face masks should be worn, and if possible with a shield. You see from this pictorial that face masks must be worn. If you have to use face shield, you have to use a face mask. In the schools should provide washing facilities, soap and water, or a sanitizer at entrance of schools. Our students should be made to use this, especially when we remember that students are in the habit of eating anything they see. They can eat anytime. Some are even in the habit of eating in class when the teacher is teaching. This is not too good, but there is no way we can stop them. Some of them have these habits. So we have to have washing facilities in each of the classrooms so that they wash their hands before they eat. Sterilizers should also be provided at entrances that will sterilize all the body. There should be temperature check immediately a student enter the school premises. The essence of this is that if the temperature is not said to be high, the student can meet the school response officer for appropriate action. The doctor can be called and the student will be taken care of so that if it's suspected to be COVID-19, it doesn't infect his co-students or any other person he or she comes in contact with. We have to maintain physical distancing, especially at the assembly ground, as well as in the classrooms. You do not greet by hugging yourselves. There's this elbow to elbow greeting. This is what we have to abide with at this present time. Entrance to classroom should be different from exit door. Physical distancing should also be adhered to in the classrooms. In some cases where we have large number of students in each classrooms, they should be divided into different groups or different classes so that we should maintain physical distancing. Washing facility or sanitizer should be in each classroom. And another important thing is that this is summer. In some countries, we are in the raining period. That should something you call the sunshine period. This is introduced on the timetable. This is a situation whereby students are made to go outside around 9 to 10 a.m. when the sun is just setting to make them warm. So if they stay in the sun for some minutes, they will be moved back to their classes. And by doing this, vitamin D is also being absorbed into the body. And we know that vitamin D is essential to the body. Now, abiding by these rules and the regulations in the classroom, at the end of the day, if they are to leave for their homes, temperature of students are taking a glean at closing time. You want to know if there is any temperature rise in any of the students. And most importantly, school administrators should ensure that they clean and disinfect classrooms, especially high-touch surfaces, and they wear disposable gloves while doing this. Also, common areas has to be cleaned and disinfected. And one important thing to know here is that all schools must have a COVID-19 response officer in case of any emergency. The duty of the officer is to make sure that if there is any situation where there is a report of any illness, the response officer should know what to do and contact the relevant authority. Now, I've told you all the things the school should be in place for you as a student or even as a staff of the school. Apart from these measures that are taken in the school environment, as a student, how can I protect myself? You have to maintain basic hand and respiratory hygiene. You practice safe food practices. Students are in the habit of eating anytime, any day, any moment. This is not the time for this. We should wash our hands before eating and should be mindful of what we eat. You should avoid cold food like ice cream and so on. You avoid close contact when possible with anyone showing symptoms of respiratory illness such as coughing and sneezing. You wear a mask when you are in a crowd, and you can make use of a scarf if you don't have a surgical mask at hand or a bandana. You ensure respiratory cough hygiene etiquette. You cough into a tissue, sleeve bent elbow, and make sure you discard the used tissue safely into a bin. And most importantly, observe and maintain physical distancing measures. You see from some of these pictorials that you can sneeze into a handkerchief, which you have to dispose neatly in a bin, or into what? A sleeve or bent elbow. You maintain social distances at least 6 meters between you and the other person, and you make sure you use your mask every now and then. What do you do in case of emergency? If you suspect you have COVID-19, you stay at home. This is to protect you, your family members, and community from contacting it. As much as possible, stay in a specific room and away from other people. This is isolating yourself, because most people with COVID-19 have mild illness and can recover at home without medical care. You keep warm by avoiding cold drinks and food. Do not leave your home except to get medical care. Do not visit public places. You take care of yourself by getting rest and staying hydrated. You can take over the counter medicines such as acetaminophen, that's paracetamol, or vitamin C to help you feel better. There have often been reports, especially on social media, on the use of some natural remedies such as ginger, turmeric, garlic, black seed oil, and so on, which can be made into infusion and can be drank while still hot, or can be used as a steamer. You can use it to steam yourself. Many people have used this, and those that have tested positive for COVID-19 ended up testing negative after using this infusion, even though this does not have any scientific justification. But social media is agog with news of this. You contact the Center for Disease Control in your country. In Nigeria, we have the Nigeria Center for Disease Control in each state. They have branches in this state. And stay in touch with your doctor. You call before you get medical care. But if you have problem breathing, be sure to get immediate care as soon as possible. If you are sick, wear a mask over your nose and mouth and try to stay at least 50 away from other people. This will protect the people around you. Avoid public transportation, that is bus sharing or taxis. Just like I've said there, the Center for Disease Control is the appropriate organization to contact. They have their phone numbers. They're in all states. They're in all countries. So you contact them for appropriate action. The Nigerian Center for Disease Control was established in year 2011 in response to the challenges of public health emergencies and to enhance Nigeria's preparedness and response to epidemics through prevention, detection, and control of communicable diseases. This center has the mandate to pick up patients and take them to isolation centers or hospitals. If you suspect that you or your loved one may have been exposed to COVID-19, you can dial this code *258 *258# for the COVID-19 self-assessment tool. Now, having presented all this to you, you will agree with me that a new normal has come. Why? Most importantly, you'll be wearing a face mask almost all the time. Avoid close contact with even your friends by maintaining physical distancing. You have to improve on your personal hygiene by washing every now and then or use a sanitizer as the case may be. You have to be washing your hands. You wash your hands with soap and water for at least 20 seconds, especially when you blow your nose, cough, sneeze, or before eating. Students are in the habit of eating, especially when in school, without washing their hands. All this has to stop. You have to wash your hands before you take anything to your mouth. If soap and water are not available, you clean your hands with alcohol-based sanitizer that contains at least 60% alcohol. Be observant enough to notice any symptoms and report to appropriate authority. Do not use self-medication. In school, report to the COVID-19 response officer so that appropriate steps can be taken. Dear students, all this may sound demanding, but we must adjust to this new trend of life, for our safety and the safety of others. The COVID-19 response officers are very important in school. These are designated officers that can take charge of students and their complaints. For more information on COVID-19 pandemic, you can contact the Center for Disease Control in your country. In Nigeria, we have the ncdc.gov.ng, or you can go to the World Health Organization website. That's www.who.int. We appreciate Shutterstock for most of the images used in this presentation. In conclusion, you remember that COVID-19 is a disease caused by a new strain of coronavirus that has not been previously identified in humans. It was first reported to World Health Organization on 31st of December 2019 in Wuhan, China. As of today, 29th of August, there is no cure for it. You have to clean your hands often, use soap and water, which is the best option. You avoid touching your eyes, nose, and mouth with unwashed hands. You maintain physical and social distancing. So you agree with now, we have to be very, very careful, stay safe, and be responsible. This is a short quiz on coronavirus, which I've presented to you, that will serve as a reminder about the disease. What is coronavirus? If you know what coronavirus is, you have to take responsibility and be sure that we abide by all protocols so that we flatten the curve of transmission. When and where was it first discovered? As at today, is there a treatment for coronavirus? No. How can you prevent it? There are ways here that I've mentioned that we can prevent it. And now that schools are opening, what measures should be taken to prevent transmission? I thank you all for listening. I will encourage any comments or questions. Thank you very much. I'll encourage comments, suggestions, or questions.
Hello?
Only yes. Knowledge one. What I have to add now is that our students need constant being reminded of this COVID-19 and enforcement. You know, children being who they are, many of them are having difficulty even using face masks. But as parents, we have to make sure that they use the nose mask every time so that they don't get infected or infect others. So enforcement is the main thing now. Many people have been talking about regulation protocols there and there, and people have not been complying with this. But then the children being who they are not, when they go to leave for school, they are not with the parents. The school authority have to make sure that they abide by these regulations and protocols so that we flatten the curve of transmission. Because if the student gets infected, the rate of transmission could be so high and it may not be contained. So that's why we have to make sure that these rules are enforced. And we talk to them, we encourage them to tell us if they notice any symptoms so that adequate action could be taken immediately.